Vancouver. We're talking COVID-19 right now and its impact on working mothers as working moms continue to be disproportionately affected by the pandemic. Right now, our next guest joins us, Shannon Christensen from Mamas for Mamas. You're the founder and CEO. Welcome to BT. Good morning.
Thank you so much for having me.
Of course. Now, your organization provides poverty relief for moms. It's a charitable group. Tell us what some of the moms who are part of your group and who come to you for services are saying about how COVID-19 has affected them personally.
Yeah, it's a really interesting time where so many people have had to completely overhaul their lives and become not only teachers for their children at home, but they are now having to spend most of their days raising their kids and most of their nights doing the work that they would normally do during the day. Their cortisol levels are through the roof, their stress levels are through the roof, their sleep is reduced, and their capacity to continue this on an ongoing basis without burnout is very challenging.
And are we seeing, Shannon, a lot of women affected because they lost their jobs during the pandemic? Because there are a lot of women in sectors like retail and hospitality and things like that?
Absolutely. Those who lost their jobs are dealing with a real economic fallout. And those who haven't lost their jobs are dealing with a real stress fallout. The mental health impact on the mothers across Canada taking on additional roles is exceptionally heartbreaking in many cases, seeing them having been in a place where they never needed to ask for help. They would be the ones dropping diapers off to the office, and they are now coming to pick them up. It's a really tough time for a lot of people, and mothers are particularly impacted by this, and single fathers.
And what about if you're pregnant during the pandemic? That obviously just creates a lot of extra stress already associated with having, whether it's your first child or a second or third child.
Oh, absolutely. I mean, not even taking into account the new stresses of trying to care for a child financially when there were one or two jobs lost in the home. Now we're looking at the impact of not having the community available to come and see you in the hospital, to come to the midwife clinic, to be your village during this time when you need it the most. It's an isolating time in a situation where you really need people around the most. So I think that it's going to be most important right now to ensure that we are looking to our neighbor to make sure they're looked after and they have enough, not to compete or compare.
Exactly. And how does your group work with moms struggling with this kind of thing, with anxiety, with depression, and financial trouble as well?
Well, yeah, I'm really glad you brought that up. So we do have the online branch communities that provide peer-to-peer support. We have those in 62 communities across Canada. And we've opened the Mamas for Mamas Vancouver branch today. And we do direct client support. We do comprehensive care plans. We go through your Maslow's hierarchy of needs, and we determine what we can do to fill the gaps in your poverty relief. And if that's economic poverty relief, if that's mental health poverty relief, we will be there to make sure that there is no mama left behind. And we do that through a mental health group. We offer it online. We offer a Soul Strong group. We offer direct counseling for a variety of different things. And you can find all of that at mamasformamas.org. And if you're ever curious about what we might be able to offer, please just reach out. If we don't offer it, there's a good chance we should.
Okay, excellent. We'll put the website on screen. And again, Shannon, where is the new location opening today in Vancouver?
It's actually in Richmond, and that space will be servicing the entire Lower Mainland. We do our best to avoid, additional overhead by keeping one office space and having multiple drivers from different areas. So it's on Horseshoe, I always say Horseshoe Bay, but it's Horseshoe Way.
Right.
And it's a really great area, and we are just beyond excited to get into the community in person.
Well, Shannon, we thank you so much for your time today and for spreading the word out there and providing support for all those working moms struggling right now during COVID-19.
Absolutely. Thanks for having me.
All right, you have a great day. That's Shannon Christensen from Mamas for Mamas, and we'll be back with more BT after this.